Dr. Virginia Lee from Capital Oral and Facial Surgery Center is back with us today to talk about trauma and what her office can offer a patient who has experienced trauma. Now, this is kind of a serious situation. Trauma includes what?
You know, in my specialty, I'm an oral and maxillofacial surgeon, so I'm really only dealing with facial trauma.
Okay, but that could be, chipped teeth or, any number of things that can happen, right?
That's right. It could be the little old lady that comes out of her house and falls down and knocks her front teeth out. Or it could be the bike rider who's cycling to work and he actually is not paying attention, or someone opens the car door and he goes over the handlebars and knocks out all his teeth or breaks his jaw.
Now, you've given us a couple of examples, and as I'm thinking about those, I think, that can happen every day. So how often do you get trauma patients? How often do they come in to see you?
You know, trauma is actually relatively common, especially in this area where there are a lot of bikers, there are runners, people are always outside, and it's a pretty heavily traveled area. So the age range is really pretty vast. It can be the little 4-year-old that was running around the coffee table and tripped and fell and knocked out a front tooth, or it could be even the bike rider. And that's actually pretty common. The biking accidents are actually very, very common.
Yeah, I bet it is, actually. Now, I've passed by, and I know everyone in D.C. probably has walked by your office. You do oral surgery, you do maxillofacial surgery, tell us about that, and now aesthetic enhancement. So that includes a lot. I know we're going to be talking about trauma, but when we talk about those types of trauma, what are those, the services that you offer, what are those people coming in to see you for? What types of trauma are you fixing?
Well, you have the person who has initially, say, knocked their front teeth out.
Okay.
Say from, running or walking or even, cycling, where the initial trauma patient that comes in. And when those patients come in, they really need immediate attention. Now, our office is really not dictated by any insurance, so we try to extend the best care possible. It's not a hospital or a clinic. We extend basically everything as far as debriding all the wounds, primary closure of those lacerations if they have them, or say wiring their jaw shut if that needs to be done, if they broke their jaw or something like that. So we try to extend the initial, care for them as soon as they actually do the trauma. And certainly within the first 24 hours, that's the most important.
Right. So we've talked about what happens initially, but let's talk about some of the long-term effects of trauma.
Yes.
And how does that relate to your profession?
Well, one of the big things is that a lot of people have had accidents when they're younger, say that front tooth that they knocked out when they were 4. And then now they're 20 or 30 or 40, and that tooth is turning darker, or they're having a little bit of swelling and things like that associated with the area. So periodic x-rays will sort of ward off any major procedures that have to be done. But frequently we see the patients that come in with that front tooth that has been knocked out many, many years ago, and now it has to be replaced. So we take an x-ray, really thoroughly examine the whole area. Many times these have had old root canals that are now failing and causing huge infections in the bone. We take the teeth out and eventually place nice big implants into that area, and then they're completely back to normal without having any signs of infection.
Well, that sounds great. Let's talk about some of the other things that you offer patients that are going through trauma. I know people come to see you if they've fallen off a bike and have knocked out their 2 front teeth, but sometimes people are a little bit, they're scared obviously about what happened to them, and they're scared about trying to get themselves looking back the way that will make them beautiful. So let's talk about some of the things that you offer patients of trauma, and just all of your patients in general.
Initially, well, once they, and this is really for anyone, but the initial trauma patient, obviously you want them to look better and normal as soon as possible. But unfortunately that does take some time. Once they've gotten over the initial recovery period, certainly there are things that you can do to enhance their appearance. If they have visible scars, you can actually do a little bit of microdermabrasion to make those scars look a lot better. And then certainly along that line of making them look better, there's always the fact that you can do a little Botox or Restylane for the patients who get a little bit older and they don't like to see those little wrinkles that are starting to form.
So you mentioned Botox, and I know we want to talk about an event that's coming up on October 26th, actually.
That's right. That's this Friday.
This Friday. Tell us what's going on that has to do with Botox.
Well, we call it the Botox party, only because of obviously the little, holiday that's coming up. But it's really for, encouraging people to take advantage of our special that we have for Botox and Restylane, anything that actually makes them look better.
So we had talked about trauma patients for a while, but then let's talk about some of the other things, since you mentioned Botox and Restylane, some of the other things that you offer patients at your center.
You know, one of the major things is obviously for enhancement, we always like to do a lot of Botox, Restylane. Those are simple things, they're non-invasive, and you get immediate results. So they can look better, you know, just leaving your office. Now, one of the more common things that we do are basically, for especially those trauma patients, is actually doing the extraction of the tooth, bone grafting, implant placement to really make their teeth look absolutely stunning. So that's really what we do.
Well, it sounds like a wide range of services, but I know today talking about trauma, if anyone has experienced that, or goodness, we don't want you to, but if you have to experience that in the future, I know exactly where we'll be going, to Capital Oral and Facial Surgery Center. Dr. Lee, thank you so much for being with us.
Thank you, Kate.
There is more Let's Talk Live, so don't go away.